In my years of practicing medicine, I've watched healthy seniors leave my office more anxious than when they arrived. Not because something was wrong, because a routine test found something that looked scary, but was completely harmless. Today I'm telling you the 5 screenings most likely to cause that problem after age 70 and what to do instead. Over 90% of healthy adults over 75 who get a full body scan will be told something is abnormal. And in most cases, that abnormality is completely harmless. But what happens next? Anxiety, more tests, biopsies, sometimes surgery, all for conditions that would never have affected their health. Today, I'm breaking down 5 common screenings that after age 70 often do more harm than good. Before we go further, drop a comment and tell me where you're watching from. I love knowing this information is reaching people who need it around the world. Quick but important disclaimer. This is educational information, not medical advice. Never stop or change your medical care without talking to your doctor first. Every situation is individual. Now, let me be clear before we start. This is not about avoiding healthcare. It is about smarter healthcare. What helps at 50 can harm at 80. Medical screening is always about balancing benefit against risk. And that balance shifts significantly as we get older. These tests all have their place in medicine. The problem is ordering them automatically just because someone has hit a certain age. That is where the harm begins. Screening 1, whole body scans. Full body scans are heavily marketed to seniors. Complete picture of your health. Catch problems before they start. They sound like a smart investment. They're usually not. Studies show that up to 40% of asymptomatic adults who get a whole-body MRI will have findings that require follow-up. Most of these are completely harmless. A small kidney cyst, a tiny lung nodule, a benign liver growth. These are the internal equivalent of wrinkles, normal parts of aging. But once found, they cannot be unfound. Suddenly you are labeled as having an abnormality. Your doctor feels obligated to investigate. That means more scans, possibly a biopsy, which carries risks like bleeding and infection, sometimes surgery, all for something that would never have bothered you. This cascade starts with 1 scan that was never medically necessary. If the scan is CT-based, there is also radiation exposure to consider. A single full-body CT delivers radiation equivalent to hundreds of chest X-rays. The cancer risk from 1 scan is small, but it is not zero. What is smarter? A comprehensive geriatric assessment. It checks functional status, balance, grip strength, walking speed. These simple measurements predict health outcomes better than any scan. It reviews medications because many older adults take 10 or more pills, and medication side effects are frequently mistaken for new medical problems. It evaluates the lifestyle factors that genuinely influence health. This gives you actionable information. A whole body scan just generates anxiety and unnecessary follow-up. Screening 2, brain MRI for mild memory lapses. Someone forgets where they put their keys. Their family gets worried and pushes for a brain scan to rule out Alzheimer's. The intention is good. The result is often harmful. Research shows that 94% of people over 75 who get a brain MRI will have abnormal findings. Brain atrophy, meaning the brain has gotten slightly smaller with age, is completely normal. White matter lesions, those small spots that look alarming on a scan, are found in over half of elderly individuals and usually just reflect years of imperfectly controlled blood pressure. They are clinically harmless for most people. But when a 78-year-old reads a report mentioning cerebral atrophy and white matter disease, it sounds like a dementia diagnosis. People start doubting themselves. They withdraw from activities. They lose confidence in their own minds. All because of findings that have nothing to do with actual cognitive function. And here is the critical part. These imaging findings do not change treatment for mild memory problems. The scan does not help you. It just worries you. What is smarter? Simple cognitive testing right in the doctor's office. The mini mental state examination, or Montreal Cognitive Assessment, takes 10 minutes and actually measures how your brain functions, not what it looks like. If results are normal, reassurance is real and meaningful. If they show problems, then look for reversible causes first. Vitamin B12 deficiency is common and easy to fix. Thyroid problems cause brain fog. Depression in older adults often presents as memory complaints. Sleep apnea impairs memory by robbing the brain of oxygen at night. Many medications, especially sleeping pills and anxiety medications, cloud thinking. Check all of these before ordering a brain scan. Screening 3. Routine cardiac stress tests. This surprises people. Isn't knowing how your heart is doing always a good thing? Not always. Routine stress tests in people with no cardiac symptoms have a very high false positive rate in older adults.
Why?
Age-related changes in the heart, long-term high blood pressure, thickening of the heart muscle, and electrical changes all affect stress test results without indicating dangerous blockages. The test says there is a problem when there really is not one. What follows a false positive? Cardiac catheterization. A tube threaded through your arteries to your heart. This is invasive with real risks including bleeding, infection, arterial damage, and kidney problems from contrast I. Most of the time the catheterization confirms the arteries are fine. You have been through an unnecessary procedure with unnecessary risk. And occasionally the stress test itself triggers problems. Heart rhythm disturbances and even heart attacks have occurred during stress testing. For someone with symptoms like chest pain with exertion, a stress test makes complete sense. But if you can climb stairs and walk briskly without problems, you are essentially passing a stress test every single day. What is smarter? Coronary artery calcium scoring. A quick low-radiation CT scan that measures calcified plaque in your arteries. A score of 0 means very low heart attack risk. A high score tells you to be aggressive with prevention. It is informative without triggering the cascade of interventions that follow false positive stress tests. Screening 4. Colonoscopy after age 75 to 80. Colonoscopy is an outstanding screening tool. I strongly recommend it starting at 45. It saves lives by finding and removing precancerous polyps. My concern is routine colonoscopy continuing into advanced age when previous screenings were normal and there are no symptoms. The benefit of colonoscopy is preventing colon cancer that would develop 5 to 10 years from now. If life expectancy due to age or other health conditions is less than that window, the benefit largely disappears. But the risks remain and actually increase with age. The bowel preparation alone can be dangerous for older adults. Drinking large volumes of laxatives causes severe dehydration and electrolyte imbalances. For anyone with kidney disease or heart failure, this can trigger serious complications. Sedation carries higher risks in older adults, including confusion, breathing problems, and blood pressure drops. Then there is perforation risk. A tear in the colon wall occurs in about 4 per 10,000 colonoscopies overall. In people over 75, that risk is higher because the colon wall thins with age. A perforation is a surgical emergency that can mean the end of independent living for an 80-year-old. The U.S. Preventive Services Task Force guidelines verify this shift. They recommend individual decision-making between ages 76 and 85 based on overall health and screening history. They recommend against routine screening after age 85. These are official verified guidelines. What is smarter? Shift from screening to symptom awareness. Know the warning signs and report them immediately. Persistent change in bowel habits. Blood in stool. Unexplained weight loss. New anemia. Persistent abdominal pain. If any of these appear, investigate regardless of age. Also maintain a high-fiber diet with fruits, vegetables, whole grains, beans, and lentils. This supports colon health every day without any procedural risk. Screening 5. PSA testing for prostate cancer in men over 70. PSA testing has been controversial for years, and for good reason. Researchers call it an epidemic of overdiagnosis and overtreatment.
Here's why.
Prostate cancer grows very slowly in most older men. Autopsy studies show that up to 80% of men in their 80s have prostate cancer at time of death. But most died with it, not from it. It was never causing problems. The PSA test cannot distinguish between aggressive cancers that need treatment and slow-growing ones that will never cause harm. So we find all these cancers. And once someone is told they have cancer, they want it treated. But treatment is not minor. Surgery causes permanent incontinence and erectile dysfunction in many men. Radiation therapy produces similar side effects. These dramatically reduce quality of life. The U.S. Preventive Services Task Force concluded that for men 70 and older, the potential harms of PSA screening outweigh the benefits. Overdiagnosis rates are estimated to be more than 15 times higher in men over 85 compared to men in their 50s. These are verified statistics from official USPSTF guidelines. What is smarter? Make it a conversation, not an automatic test. Family history and individual risk factors matter and might shift the balance. But it should be an informed discussion about real numbers and real risks. For men already diagnosed with very low-grade prostate cancer, active surveillance is often the best choice. Monitor without treating unless the cancer shows signs of becoming aggressive. Quality of life is preserved. The bottom line: these 5 screenings share one thread. They all involve searching for problems in people without symptoms. And as we get older, that kind of searching becomes less likely to help and more likely to harm. Here is what actually matters more than any of these 5 tests. Know your warning signs and report them immediately. Maintain the healthy habits that genuinely protect you. Build a relationship with a doctor who knows you as a person, not just a patient. And ask questions before every test. What will we do differently based on the results? What are the risks? What happens if I choose not to do this? You have every right to ask those questions. Medical care should be a partnership. Smart healthcare after 70 means focusing on maintaining function, independence, and quality of life, not just finding every possible abnormality. If this video helped you think differently about your healthcare, drop a comment below. Have you ever felt pressured into a test you were not sure about? Tell me what happened. If someone you care about is over 70, share this with them. It could protect them from unnecessary procedures and real harm. Hit that subscribe button for more senior health content right here on the Sarah Mitchell channel. And remember, smart healthcare means knowing when to say yes and when to say no. I will see you in the next video.